The International Patient's Journey. Every year, thousands of patients from around the world seeking complex treatment at UCLA Health overcome many roadblocks to receive care. UCLA Health keeps patients at the heart of what they do, providing support from across the globe to patients from all walks of life so they can focus on treatment and recovery. The journey begins when a patient realizes their condition cannot be treated in their home country and must seek help from an international healthcare provider. Patients find their way to UCLA Health through a variety of channels, including referring agencies, through networks and past patients, or through their own government.
My name is Nasser Ali Sham. I came here to UCLA to get the treatment for my son, Jasim. We get some treatment in our country, in Qatar, but it's not too much. So that's why we searched in the Google and we looking very good viewing for the UCLA. That's when we try to go ahead to come here to get the treatment here, and we get excellent care for my son here.
Once a patient inquiry is received, a case manager reviews the medical records and submits reports to the appropriate physician for further review and acceptance. If accepted, the patient makes travel arrangements, appointments are scheduled, and a coordinator will provide them with a list of accommodations and places of interest. After making the flight to LA, transportation is ready to take the patient to their hotel or directly to the hospital. The patient and their family may need complimentary assistance with language interpretation services, transportation to and from medical appointments, and other services. Patients often do not know what to expect, so a coordinator will give them a brief orientation along with their schedule of appointments. The patient is then evaluated by UCLA specialists who review their treatment plan. A case manager assists the patient with the plan outlined by the specialist, updates the payers, and obtains authorizations for recommended medical services. In case there are any language or cultural differences, a coordinator is there to support the patient.
My name is George Nino, and I am an access coordinator at UCLA Health. Part of my job is to help patients find the location of their appointments. A lot of times we go with them to these appointments to interpret, even when the patient is fluent in the language, in English. We like to be with them just to explain certain terminology.
When the patient receives clearance from all specialties for discharge to their home country, we prepare the required prescriptions, medical records, and a UCLA physician connects with the patient's home physician and communicates a care plan to ensure a smooth handoff.
My name is Juan Alejos. It's an honor for me to be able to take care of patients who come to us from places where transplant is not as common, especially in children with congenital heart disease. But I think some of the most important things with that is essentially the handoff, both pre and post. Initially, for us to really get a good feel for whether this child needs a transplant, and two, will benefit from a transplant, it's important for us to be able to talk directly to the physicians internationally.
The international patient faces personal, logistical, financial, and other challenges to receive care at UCLA Health. With the help of the patient navigation and business services team and the world-class providers at UCLA Health, these patients are able to feel more comfortable in a truly foreign setting and focus on their treatment and recovery.